Good evening, this is Dr. Uday Thanawala, a gynecologist practicing in Navi Mumbai, and today we'll speak a little bit about a very common entity which many women have and suffer from, and that is fibroids, uterine fibroids. Now, what are these fibroids? Fibroids are benign, yes, they are benign tumors of the uterus. So, you have this rounded whorled appearance of a musculature which starts growing in the uterus, and that is what develops to be a fibroid in the uterus. And many a times we have women coming to us with reports on sonography, because obviously it is picked up very well on sonography that, oh, I have a fibroid, now what do I do? So let's look at the fibroid, where all it can be, what ages it appears, and what do we do if somebody is diagnosed with having a fibroid. A lot will depend upon where the fibroid is. Now obviously the fibroid is in the uterine cavity, but as you see, the uterine cavity has got three layers. One is the innermost layer, from where the endometrium grows and is shed off, and that is what is known as the regular menstrual cycle happens from. The middle layer is the musculature layer, and the outer one is the covering of the uterus, known as the serosa. So the fibroids can occur in either of these three layers, and if they are growing very near the cavity of the uterus, they are known as submucosal fibroids, that is 0 to 1. And if they are in the musculature, where maximum of the fibroids are, because ultimately it's a muscular tumor, they are known as intramural fibroids, that is from 2 to 5 are all intramural fibroids in the diagram. And if it is very near the outer layer of the uterus, they are known as subserous fibroids, and generally this is the classification followed everywhere. What is important is, it is the 0, 1 or the fibroids near the uterine cavity which may actually cause the symptoms to a woman. A woman may have a lot of heavy bleeding, what is known as menorrhagia, or irregular shedding or irregular bleeding throughout the cycle, and that is the main symptom which a fibroid would present with. If the fibroids become very large, they can be from any size, from 1 centimeter, which generally don't cause any harm at all, to something as large as 5 to 6 centimeters, or even reaching very large proportions like 10 to 15 centimeters, and sometimes occupying quite a bit of the abdominal wall. So when a fibroid is very large and it's occupying quite a bit of the abdominal cavity, then it causes pressure symptoms, pressure on the bladder, pressure on the rectum, pressure on the bowels, and that can lead to other symptoms like frequent urination, constipation, or pain while defecating. Sometimes the fibroids grow very large, but the woman doesn't realize it. And when she comes for an examination, and you form a huge mass in the abdomen. So the presentation of a fibroid can be totally asymptomatic to having symptoms like pressure symptoms, menorrhagia, etc. So that is where it is. Generally, fibroids occur in an older age group, around late 30s or 40s. But sometimes very young girls also we have seen with fibroids, even sometimes adolescent or teenagers also with small or big fibroids happening. So everything of the fibroid varies. And what do you do when you have a fibroid? Well, if it is asymptomatic, if it is not causing any symptoms at all, just leave it alone. It really doesn't matter if you have a benign tumor growing in the uterus. If it is more than 5 to 6 centimeters, and if it is causing pressure symptoms, or if there are multiple fibroids in the uterus, then yes, which are more than 4 to 5 centimeters, then yes, you may try and remove the fibroids. And today removal has become very simple, because one does a laparoscopic removal of the fibroid, which is a little skilled surgery, but it generally is very easy on the patient. The recovery, etc., is very great. Sometimes fibroids are there, and if a woman is trying to conceive and cannot conceive, then the question arises, is the fibroid leading to problems in becoming pregnant? For that, it is important to know that it's only the 0 to 1 group, or at the most 0, 1 and 2, very near the lining of the uterus, fibroids which distort the cavity of the uterus, they are the ones which may lead to problems in conception or may cause abortions. Fibroids which are not close to the uterine cavity or which are a little bit away would generally not cause any of these symptoms of infertility. So one has to be very cautious in removing fibroids which are small and which are not in any of these places, because actually they may not be warranted to be removed and they may not help in the treatment of infertility. Yes, of course, your doctor or your infertility specialist will take a particular call on it if a fibroid needs to be removed or not. But in general, the rule is a fibroid which is very near the cavity of the uterus or distorting the cavity of the uterus may require removal. And the removal of this fibroid is not difficult because it is generally done through a hysteroscope. It is a scope passed through the uterine cavity, through the cervix, and it's done from below. There are no scars in the abdomen and it's a relatively simple surgery. So a hysteroscopic removal of the fibroid is possible in these cases. What happens if a woman who has fibroids become pregnant? We have some people who get pregnant, they get an ultrasound done, then they come to us, oh my God, I've also got a fibroid there. In generally, the baby should not be affected because the fibroids will generally not cause much of a problem. They would flatten out as the pregnancy grows. And once in a while, if the placenta is adherent to where the fibroid is growing, yes, you may have a little low birth weight babies because the blood supply to the baby is affected. But besides that, the fibroid actually would come into the picture when she's delivering. And if the fibroid is in such a position that the baby's head can't come down and cannot deliver, in that one can resort to doing a cesarean section because of the position of the fibroid. But fibroids with pregnancy, though not uncommon, are rare, and in general, fibroids are benign tumors which generally do not cause too much of a problem. Now, is there any other treatment besides surgery for fibroids? Well, lots of things have been tried out. We have long depot preparations of injections which try to suppress the fibroid and shrink the fibroid. We even have newer drugs, uripistol or mifepristone, which now people are trying out because they decrease the blood supply of the fibroid and thus decrease the size. They may also decrease the symptoms like menorrhagia if a young girl has to be conserved and we need to pull her over for some time and not do a surgery. Yes, these drugs can be used for a short period of time because these drugs are effective till as long as they are used, but generally they do not work very well and the fibroid may regrow after the treatment is stopped. A newer modality of ultrasound waves which are used, and MRI directed ultrasound waves to keep the fibroid under control, is being tried out. It is proving to be good, but it is as yet experimental. So we have yet a proper medical treatment to come or shrink the fibroids or treat them. Till then, surgery does remain the mainstay of treatment, but one has to choose which fibroids to remove, which actually require removal of which fibroids will actually help the women. So that's about fibroids, and if you have any questions or any further queries, you can log on to thanawalamaternity.com for more information.